técnico.
Pantalla, por favor.
Como mencioné ayer o en la inauguración, la región de las Américas financia con sus propios recursos de los países el 99% de los programas de vacuna. Y eso se debe mucho a ese tema del sostenimiento y de las leyes de vacuna que protegen los programas de vacunación. Así es que vamos primero a mirar la análisis de la evolución histórica de la legislación en los varios países y Cara Janus nos va a introducir el tema. Cara.
Muy buenos días a todos. I have the pleasure of speaking to you this morning about vaccine legislation in the Americas. I'll give you a little more background throughout the presentation, but we have taken up in the past few months some work on doing a descriptive analysis of the current status of vaccine legislation in the Americas, and this is a continuation of work that had been started quite a few years back. So briefly, I'll speak to you today, like I said, about the background of this work, the current analysis that we undertook to describe some of the key aspects of vaccine included in vaccine legislation in the Americas, as well as some best practices or innovative ideas that we identified in these legal documents, and then the next steps and conclusions that we drew from this study. Recently, in the years since 1996, we've seen an incredible increase in the number of countries that have introduced vaccine legislation in the region. And then in the years 2005 and 2008, PAHO undertook the initiative to begin gathering legal documents from countries in the region to do an initial analysis of the actual content in these laws. And this helped to begin the process of developing a model law that would serve to guide countries in the implementation, or rather the development of vaccine legislation in countries where this already had not taken place. More recently, we decided to update this database as a few years had passed, and in March of 2011 this year, the Sabin Institute convened a symposium in Africa to look at some of the potential of using the lessons learned in the Americas extracting lessons learned in the Americas to encourage countries to draft vaccine legislation for national immunization programs in Africa. To give a little bit of historical context of vaccine legislation in the Americas, after the creation of expanded programs of immunization, programs in the Americas developed plans of actions to identify and prioritize need areas. In this process, it was identified that largely the programs were dependent on external resources. As the regional initiative to eradicate polio from the region was implemented, with this initiative came large investments into the immunization programs. And as the programs were able to demonstrate great achievements, this also attracted attention from other actors external to the programs, including civil society, the private sectors, and particularly parliamentary bodies. And then since the 1990s, as I mentioned, we've seen an increase in the number of countries that have moved forward to establish vaccine legislation in order to provide a legal basis for the national immunization programs, as well as ensure financial sustainability for program activities. Currently, there are nearly 23 countries in the region that have comprehensive vaccine legislation implemented. When I say this, there may be many more countries that have introduced vaccine legislation, but this is based on the database that we have at PAHO, where countries submitted legal documents upon an initial request. And as you can see, since the 1980s, there's been a significant increase in the number of countries that have moved forward with this initiative. To give some more historical context, in our database of legal documents, which ranges from Grenada's Vaccination Act passed in 1883 to proposals of laws in many countries currently. The Caribbean countries generally passed legislation in the 1970s and the 1980s, while Central American countries, with the exception of Costa Rica and Nicaragua that had long-standing vaccine legislation, generally passed legislation in the last 10 years. South American countries we've seen began implementing or passing vaccine legislation around 1982. A little historical note that I found interesting: Grenada's Vaccination Act from 1883 attempted to ensure the prevention of, or that smallpox would not continue to spread in the region, and had a stipulation that would fine parents for failing to vaccinate their children. Today, as I said, over 20 countries in the region have comprehensive legal frameworks in place for immunization. At a quick glance, as I said, 27 countries in the region provided examples of legal documents that are in place in their country to support vaccination. We received a total of 37 documents, and of these 37 documents, 15 were specific to vaccination laws. Other documents included executive decrees, more regulatory documents emitted from particular ministries, educational laws, as well as general public health acts. And there are also many countries that either are in the process of reviewing their current vaccine legislation or working with law proposals at the moment. In our analysis, we wanted to look at three primary aspects of these vaccine laws, including declarative aspects, financial aspects, and operational aspects. In doing this, we hope to identify some of the innovative ideas that are found in these legal documents. As you can see, if we look at these three aspects over time, declarative aspects have always been a very important component of vaccine legislation. And when I say declarative, I refer to stating that vaccines are a public good, ensuring free and equitable access to vaccines to the entire population. Over time, financial aspects have also become very important in vaccine legislation to ensure financial sustainability of the program. And to date, the majority of legal frameworks in place in the region have a heavy focus on the financial aspects of vaccination. We also wanted to look at the achievements of the programs over the years in relation to vaccine legislation implemented as well. And as a proxy, we crossed DTP3 coverage in the region with the number of laws. As you can see on the left side of the graph on the y-axis, you see the percent of coverage that has increased over the years of DP3 vaccination, and then on the right side, the number of laws. And while we're not attempting to make a causal relationship here, it is descriptive of, as programs have been able to establish a legal basis, it does protect the achievements that have been implemented over the years. Finally, when looking to some of the examples that we found according to these three aspects that we wanted to apply to the legal documents, I wanted to highlight some of the major ideas that came out according to these three aspects. Under declarative aspects, as I said, 14 of the 27 countries that have legal documents in place in support of vaccination ensure free access to vaccines for the entire population. 24 of the 27 countries have stipulations that require vaccination for school entry. When we look to operational aspects, many of the vaccine laws in the region have used these documents to establish a legal basis for the National Immunization Technical Advisory Groups. As we were discussing this morning, the variability in the actual operational implementation of these committees ranges across the region. But for many countries, this has served as a way to establish a firm legal basis to ensure the continuity of these National Immunization Technical Advisory Groups over the years. As well as many of the legal documents, 21 of the 27 countries that we looked at include establishing the legal basis for the National Immunization Schedule. And finally, when we're looking to financial aspects, there were three important ideas that we extracted from the legal documents we reviewed in the region. First, establishing an explicit budget line for the purchase or procurement of vaccines and also financial support of the program. Many countries have included in their vaccine legislation a very specific earmark that is towards the expanded program of immunization. A few countries also have included in their vaccine laws tax exemptions for the purchase of vaccines. And finally, multiple countries in the region have explicit mention of a formal purchasing mechanism, specifically the revolving fund. Finally, just to give you a quick snapshot of the relationship between establishing a legal basis for vaccination and moving from an external dependence, financial dependence for national immunization programs to an internal dependence. The region of the Americas, as you can see, has increased their financial responsibility for programs by 20% over the past few decades. Finally, in conclusion, we would just like to say that the existence of legal frameworks can serve to protect the financial sustainability of programs and also to provide a legal basis for some of the operational aspects of the programs. As next steps, we look forward to continuing to document the experience of the Americas and advocating that countries that have not implemented vaccine legislation in their countries to follow the examples of many of your neighboring countries. Thank you.
Gracias, Cara. Solamente comentário sobre a história, porque mencionaste que a lei modelo foi elaborada em 2005, pero historicamente a questão é pouco mais antiga. A primeira lei modelo se apresentou ao Parlamento Latino, que é o Par Latino, no final da década de los 80, quando começou o programa de polio, que vimos que havia grandes inversões para hacerlo. E nesse entonces o presidente do Parlamento Latino era parlamentário cubano. Discutimos com eles esse problema e ele pediu que a OPS preparara modelo para ele apresentar ao Par Latino, o que ha hecho, e de aí entonces começou a filtrar-se aos parlamentos latino-americanos. O sea, provavelmente a lei de 2005, a lei modelo, talvez foi uma atualização desse tema. E depois também o Instituto de Saúde de Carlos Slim também organizou um outro modelo de lei, um comitê que inclusive nós outros participamos, pero o primeiro movimento desse foi nos anos 80. Também o mais importante que temos é de que esse slide que se apresentou com a gráfica que mostra que a evolução e o aumento das inversões nacionais é realmente impressionante. E isso nos ha motivado no Instituto Saving a estabelecer programa com a ajuda da Fundação Gates em países Gavi, para que eles também melhorem a financiação desses próprios programas. Então, estamos trabalhando com 12 países africanos e 3 asiáticos, estamos trabalhando com os parlamentos desses países para motivá-los a hacer algo similar como en América Latina. Y en ese tema yo tengo un gran placer y honor de presentar a ustedes el diputado Alejandro Zapata, un gran amigo parlamentario de Bolivia, que participou com nós em um seminário que tivemos com parlamentares africanos no mês de março em Etiópia, e o deputado Zapata apresentou as experiências de América Latina, ou seja, que estamos levando essa experiência latino-americana para a África e para outras partes do mundo. Estimado amigo deputado Alejandro Zapata, bem-vindo.
Muchas gracias. Cara es bien alta, Ciro. Primero quiero agradecer a los auspiciadores de este evento por darme la oportunidad de dirigirme a todos ustedes. Voy a pedirles el permiso de que muy brevemente podamos ver 7 slides y presentar una segunda parte de lo que realmente quisiera manifestarles en esta oportunidad. El proceso de creación de la ley de vacunas se inicia a partir del 2000 con un decreto supremo por el cual se le asigna el 5%. Primero, decreto supremo, que es solamente una voluntad política del presidente. Como ustedes saben, el presidente puede cambiar de parecer o puede cambiar de gobierno y no se le asigna más recursos para este tipo de proyectos. El 2010, la contratación de consultorías para consensuar la propuesta de ley. El 2003, ahí ingreso yo soy parlamentario por segunda vez. Ahí iniciamos un contacto con varios técnicos, varios especialistas nacionales e internacionales que realmente generaron esta reflexión que necesitábamos respecto a la importancia de las vacunas. Juntamente un grupo pequeño de parlamentarios generamos un gran consenso nacional para la aprobación de la ley de vacunas. El 2004 el Ministerio de Salud introduce la propuesta de ley en el Parlamento y el 2005, ya casi concluyendo la gestión, se aprueba la ley 3300 en diciembre de 2005. Voy a darles solamente algunos elementos que consideramos importantes, los que están remarcados para que ustedes puedan observar cuáles son las potencialidades de esta ley. Uno de ellos es proveer los recursos económicos permanentes y necesarios para el logro y cumplimiento del objetivo señalado. Es decir, generar que año tras año, cuando se genera y se elabora el presupuesto general de la nación, como en varios países identificado, se garanticen los recursos necesarios. La institucionalización y el funcionamiento del Comité Nacional según ley, de inmunización con órgano de consulta, asesoramiento en las políticas de inmunización, funcionará bajo la tuición y dependencia del Ministerio de Salud y Deportes, como es actualmente. También todo personal de salud público privado queda obligado a participar en la prevención de enfermedades inmunoprevenibles. Otro de los elementos es que todo niño menor de 2 años deberá ser inmunizado de acuerdo a lo previsto en esta ley conforme a las disposiciones que dicta el Ministerio de Salud y Deportes. Los padres, representantes, tutores encargados de la custodia del menor serán responsables del cumplimiento de la obligación. Ahí, por ejemplo, quisiera destacar que ha sido un proceso muy difícil por un tema cultural. En Bolivia existen 16 naciones originarias, 32 naciones originarias, y la forma de ser, la cultura de los pueblos era muy difícil ingresar en algunos sectores para generar esta conciencia. Ahí se tuvo que tomar medidas, por ejemplo, de que no se podía inscribir al niño si no tenía las vacunas necesarias para poder tener educación. Hoy hay inclusive algunos incentivos que les voy a indicar más adelante. El marco legal que tenemos, la base fundamental, es la Ley 3300 de vacunas, aprobada en el 2005, ya las políticas nacionales del Sistema Único de Salud, ISAPSI, el Plan Sectorial de Desarrollo 2010-2020, el Programa de Desnutrición Cero, el bono Juana Zurduy promueve la vacunación institucional. Este bono es bien interesante. Además lleva el nombre de una gran guerrillera boliviana que ha luchado por la independencia de nuestra querida América. Este bono incentiva a las madres a recibir un recurso que no es mucho, pero le obliga a que para poder recibir este dinero pueda presentar las tarjetas de vacunación de sus niños. Esto realmente es un incentivo muy fuerte porque las madres recurren a este bono y que para poder recibir estos recursos tengan que presentar este requisito. La participación de los municipios en la Ley 2687 del Seguro Universal Materno Infantil, que incorpora la vacunación obligatoria gratuita en los niños menores de 5 años y mujeres en edad fértil como un derecho universal. Como ustedes saben, la vacunación no es tarea solamente del gobierno. Esta también es tarea de los gobiernos departamentales, gobiernos municipales. Esta es una tarea de absolutamente todos los actores. Los logros concretos posteriores a la ley de vacunas, el PAI cuenta con financiamiento nacional a través de los fondos del Tesoro General de la Nación, el 5% de la Caja Nacional de Salud, que le brinda solidez y sostenibilidad financiera permanente al programa. Cuenta con financiamiento adicional a través de cooperación externa a nivel nacional, departamental y municipal. Ahí tenemos la participación de la OPS, UNICEF y la Alianza Gavi. Se realiza la compra exclusiva de vacunas, jeringas e insumos a través del Fondo Rotatorio de Vacunas de la OPS. Se han introducido nuevas vacunas de rotavirus e influenza y se cuenta con un plan de introducción de las vacunas como el neumococo. A nivel nacional se cuenta con un Comité Nacional de Inmunización con base en la ley de vacunas. Este cuadro es interesante porque antes de la ley de vacunas teníamos una cooperación de más o menos el 65% de la cooperación internacional. O sea, no era una prioridad para el Estado. Hoy, en este presupuesto, se está destinando alrededor de 20 millones de dólares, que es, digamos, el 80% del presupuesto. Y, por supuesto, hay un 20% de la cooperación internacional. O sea, este es el gran efecto que se ha generado y es el efecto que definitivamente era un objetivo hace años. Estamos proyectando que para el 2012-2013 se incrementa a 21 millones el 2012, a 23 millones el 2013. O sea, decir, cada vez tenemos que ser más autosuficientes respecto a el tema de las vacunas. Sin embargo, yo he visto que todos estos resultados en varios países ya se han dado. O sea, todos están caminando a su paso y en base a las posibilidades que tienen como Estado. Lo bueno es que todos avanzamos y avanzamos por un bien común. En nuestro país hemos tenido que pelear mucho desde estos años. Ahí yo quiero rescatar la presencia de gente de otros países, de organismos internacionales que se han comprometido con mi patria y han impulsado estos procesos. Han ayudado a generar una conciencia nacional. Hemos generado una responsabilidad que no solamente son de las autoridades políticas, no solamente son de los técnicos, es del pueblo en general, es una responsabilidad de todos. Hemos generado un gran acuerdo nacional. Ha sido difícil, pero ahí están los resultados. Hemos avanzado a nuestro paso y creo hemos avanzado bien. Otro de los elementos importantes, yo he escuchado las participaciones. Aquí el escenario, estoy frente a gente específicamente técnica en el tema y los políticos no conocemos muchas veces porque a veces hay cambio de gobierno y el peor error que pueden cometer los gobiernos es uno de los peores errores, destituir al personal de salud en temas de vacunación, por ejemplo. Eso es porque ese personal es personal estratégico, personal clave. Como ahora, este no es un gasto, este evento es una inversión. Porque yo aprendo mucho de las participaciones de otros países y nosotros tenemos que cuidar este recurso humano estratégico. Por eso esa conciencia que debemos generar en los políticos respecto a un tema tan delicado. Difícil, pero hemos conseguido entender que hay que despolitizar las políticas de salud. Porque cuando nosotros los políticos entramos, realmente confundimos. Y la vacuna no tiene color político, no es ni de la izquierda ni de la derecha, ni del oficialismo ni de la oposición. Yo soy un diputado opositor, pero soy presidente de una de las comisiones más estratégicas, como es Educación y Salud. Por eso hemos avanzado respecto a lo que deseábamos a un inicio. Estamos generando realmente una política de Estado, porque como pasa en otros países, tenemos que garantizar y conseguir que aunque cambie de gobierno, o sea, la política de vacunas siga y el compromiso del Estado siga, porque no podemos incorporarnos a las decisiones de un presidente u otro presidente, o a las decisiones de un ministro u otro ministro. O sea, decir, debe continuar. Y para esto creo que todos ustedes, los que están aquí presentes, aquí tenemos un grupo importante de técnicos bolivianos y yo tengo que convertirme en el aliado estratégico del sector y un protector de este sector tan importante para mi país. Ahora estamos trabajando desde la Comisión de Educación y Salud para profundizar aún más este tipo de campañas, decir que la vacunación es una responsabilidad de absolutamente todos y los empresarios tienen una responsabilidad social con la vacunación. Por eso estamos identificando empresas que tienen importantes ingresos de recursos, como la cervecería, por ejemplo, para que realmente puedan aportar con este cumplimiento patriótico que tenemos de salvar la vida de nuestros niños. Estamos recurriendo a los medios de comunicación, por ejemplo. Es decir, los medios de comunicación no puede ser que no le den importancia a las campañas, no puede ser que no generen conciencia y solamente busquen generar mayor cantidad de ingresos. Ellos tienen también una responsabilidad social y les estamos planteando que en los horarios claves se informe todos los días, que todos los días se vacuna en los centros de salud en Bolivia, porque la gente no sabe, algunas esperan solamente la campaña de vacunación, pero este es un tema de diario, porque tenemos el desafío, tenemos la obligación de trabajar los 365 días del año en favor de la vacunación. Luego, decirles que tenemos un desafío histórico ahora en mi país. En mi país ya estamos con un proceso de transformación y cambio y nosotros entendemos que no podemos tener dependencia de absolutamente nadie. Tenemos que tener la suficiente fuerza como país para garantizar el 100% de nuestra vacunación. Tenemos que ser un país digno. Un país digno es el que ya no recurre más a nadie y se vuelve poderoso, fuerte respecto a esta conciencia que queremos generar. Podemos ser un país pobre, tenemos muchos problemas, pero somos un país digno. Queremos nosotros garantizar el 100% de la vacunación en nuestro país y prepararnos para lo que viene, por supuesto, con la ayuda de amigos como el señor Cuadros. También decirles que podemos perder en el fútbol, pero queremos ser campeones en la vacunación. Solamente existen momentos como este para poder agradecerles a agencias de cooperación internacional, a organismos internacionales, pero además de ser instituciones, a esas personas que han posibilitado que en mi país avancemos. Es decir, no hay posibilidades y hay gente que se ha comprometido con mi país, vive en mi país, hay gente que vive más de 15, 20 años, que han llegado precisamente para estos procesos y se han quedado enamorados de mi patria. Decir a través de ti, Ciro, muchas gracias a esos hombres y mujeres que dejando su hogar nos han apoyado, nos han ayudado y les digo y les pido, no nos dejen, necesitamos de su compromiso, de su cariño y de su afecto. Antes de que Ciro apriete el botón, quiero también decirles a todos ustedes, no se detengan. El camino es fuerte, ustedes son técnicos, debemos convencer a los niveles políticos. Es una misión muy difícil, pero una misión no imposible, porque estamos precautelando lo más hermoso que tienen las naciones, los niños, las niñas, el presente y futuro de esta humanidad. Eso que sea para ustedes su fortaleza, para que regresemos a nuestros países y realmente tengamos muchas más ganas para seguir trabajando, porque hay desafíos muy importantes. Quiero compartir con ustedes algo que me pasó más o menos en el 2002 para terminar, y es que yo era diputado, soy diputado por segunda vez, viene un ministro de Salud, me dice, mire diputado, como no había ley, entonces era pelea, ahora la ley nos garantiza que no tengamos que pelear mucho, pero era una pelea. Y el ministro de Salud me dice, lo que hemos programado, diputado, no lo vamos a poder obtener porque el gobierno, el presidente ha tomado algunas decisiones y tiene otras prioridades. Y yo voy, ¿y cuál es el problema? Dice, es el ministro de Obras. Y yo pido audiencia con el ministro y el ministro me dice, ¿sabe, diputado Zapata? La vacuna no la vemos. Para nosotros es una prioridad construir esta carretera, este puente. Eso es lo que ve la gente, eso es lo que ve la gestión. Y yo le digo, ministro, ¿cuánto cuesta 1000 kilómetros de carretera? ¿Cuánto cuestan 100 kilómetros de carretera? ¿Cuánto cuesta 1 kilómetro de carretera? ¿Cuánto cuesta 1000 vidas? ¿Cuánto cuesta 100 vidas? ¿Cuánto cuesta una vida? Pónganle precio. Gracias.
Gracias, diputado Alejandro. Certamente son líderes como ustedes que protegen la salud de las poblaciones de nuestra América. Y es impresionante porque Bolivia es uno de los países de bajo ingreso, está en la lista de Gavi, pero si ustedes observan, financia 80% de su programa. Ese es un ejemplo muy importante que debemos tener en cuenta. ¿Comentarios y preguntas? De las dos presentaciones.
Necesitamos más líderes como él. Absolutamente, fue fantástico.
Comentarios sobre la presentación de Cara y del diputado. John.
Thank you, Cyril, and thank you to both presenters, Cara, for wading into this topic, and for Diputado Zapata for his appeal and leadership for all of us. I think it's really neat to capture these country experiences. One of the other very impressive experiences for me last October at the sub-regional meeting of the Andean and Southern Cone countries was Peru's results-based budgeting program, linking program with finance, working with the ministers of finance, working with the economists to link the budget to the results and what's being actually done in the field, and then returning to the Ministry of Finance and asking for additional resources. So I think there are a number of very interesting experiences here in the region that we can share with one another and continue to drive this agenda. The bottom line for all of us is sustainable financing. Thanks, Vlad.
Ali?
Yes, thank you to both of you for those very interesting and inspirational presentations. I have a question actually for Pajo to consider, and related to the three different categories where there is legislation that exists within the Americas, and they are within the declarative, operational, and financial aspects of immunization, and where the evidence is to support those elements, where it is strongest in terms of influencing and supporting and improving immunization policies in the jurisdictions. I think it would be very useful to have that. And again, I'm going to speak a little bit on behalf of Canada. Even though there aren't any federal immunization laws, there are provincial immunization laws in some jurisdictions that require immunization at school entry as well. So I hope you have that on your list.
Who from Pajo wants to? You want to answer that, Cara?
Is this on? Okay. Thank you for that comment, Dr. King. I think it's an important point you make to draw a correlation between legislation and also the impact of legislation towards achieving goals. But I think it's also very hard to demonstrate that quantitatively, and so that's why we drew from this descriptive analysis, descriptive correlation between program outcomes and the increasing number of vaccine legislation in the region.
Sí, muchas gracias. Como haya mencionado Cara, hay una cuestión conceptual de un modelo general de ley, pero esto es adecuado a cada país, ¿no? Porque cada país tiene reglamentación interna. Entonces, hay países que la ley no puede establecer cuestiones financieras, porque la cuestión financiera está regulada por otra ley. pero el establecer simplemente el criterio declarativo le da suficiente fuerza para ir a buscar recursos financieros, ¿no? Entonces, eso depende de cada país. Pero indirectamente lo que hemos observado, y el ejemplo más claro lo tenemos aquí en Bolivia, pero lo hemos visto en Perú, lo hemos visto en Honduras, lo hemos visto, cuando hay una ley y esa ley se lleva adelante y se sigue adelante, se refleja en resultados, ¿no? Y se refleja en presupuesto, y se refleja en coberturas, y se refleja en compromiso y en recursos humanos. Cuando eso no existe, siempre estamos en riesgo, ¿no? Siempre estamos en riesgo. Entonces, puede ser una ley, un reglamento, un decreto, cada país tiene diferentes niveles de reglamentación y de operación, pero eso nos ha permitido siempre proteger al programa de inmunizaciones. Y lo primero es esta parte declarativa de considerar a la inmunización como un bien público que está puesto en la OPS, como declaración de los ministros, que está puesto en las leyes, etcétera. Eso nos ha permitido, como decía Ciro, que el 99% del programa de inmunizaciones sea financiado con fondos nacionales en la región de las Américas.
La OMS ha hecho un análisis de los mundial sobre ese tema y hay una relación bastante importante en los países que tienen leyes y las coberturas de vacunación. En ese proyecto que estamos trabajando en África y Asia, hace 3 años que estamos trabajando, y ya en esos 3 años, ahora recientemente se ha hecho una evaluación independiente, más de la mitad de los países ya están haciendo borradores de leyes para los parlamentos, y están já aumentando os recursos nacionais para os programas. Ou seja, havia países incluso que não estavam pagando incluso a mínima cota para a GAVI, que agora já começaram a pagar. Ou seja, o impacto realmente se vai mirar em mais uns anos, mas não há nenhuma dúvida que esse tema é de alta importância. John?
Thank you, Ciro. To add upon what Gualtemo mentioned, if my memory serves me correctly, about 4 or 5 years ago, we had a benefit of having a law student who was getting her MPH at GW University, and her project was to look at the epidemiology of vaccine laws in the Americas. And she found a suggestive correlation to measure the impact with vaccine coverage, but the numbers were small, so the study wasn't powered to show a statistically significant result. But I think we probably made the mistake of limiting ourselves to the epidemiologic approach to this, and perhaps we should be opening up the window, as you just whispered in my ear, to a more qualitative analysis, digging deeper into the Latin American experience to identify the areas of impact in a qualitative way, interviews and so on.
¿Algún otro comentario? José?
Gracias. Hay otro aspecto en relación a la implantación de legislación que al momento que comprometemos a los gobiernos a invertir, tenemos un mayor compromiso como programas de cumplir. Porque, por ejemplo, en Estados Unidos, por ley, los niños tienen que presentar una cartilla documentando su vacunación, por ley. Ha sido un tema difícil en algunos países porque realmente a dónde llega la libertad personal. Pero yo creo que el hecho de que se implante o que se legisle es muy bueno, pero tenemos mayor responsabilidad en el cumplimiento, porque comprar la vacuna hay que aplicarla, y tenemos que, la evidencia es, obviamente, que los niños están inmunizados. Y tenemos otra instancia, tal vez va a ser difícil, pero el Reglamento Internacional Sanitario puede ser otro mecanismo de ley internacional. De hecho, comentábamos ayer la idoneidad de que con el motivo de la eliminación y erradicación de rubéola y sarampión, pudiese incluirse en el Reglamento Internacional Sanitario, que sería otro nivel de ley, que esas vacunas se aplicaran. Gracias.
¿Algún otro comentario? Brasil.
Yo también compartilho con la idea que para nosotros la garantía de que tenemos la ley para mantener los presupuestos del Programa Nacional de Imunizaciones fue la forma de garantizar aportes de recursos ano a ano. No entanto, temos a obrigação de utilizar bem esses recursos, porque somos cada vez mais cobrados pelos órgãos de controle que controlam os pressupostos, que temos que gastar os pressupostos, garantizando as coberturas vacunais. Então, tem também impulso na manutenção das coberturas vacunais. Então, eu creio que é uma mão dupla que temos que trabalhar na garantizar as leis, mas também garantizar o uso adequado dos pressupostos.
Esse ponto é extremamente importante, incluso nessa experiência que estamos tendo em África, é muito importante porque os parlamentos também querem the accountability, é algo muito importante, e isso obriga a melhorar a gerência dos programas para saber realmente como se estão usando os recursos, ou seja, é um doble caminho. Algum outro comentário? Bueno, muitas graças e realmente eu penso que congratulamos a UPS pelo trabalho que está haciendo e se deve continuar profundizando nesse tema. Passamos então agora à semana de vacinação nas Américas para que Alba Maria Ropero nos atualize sobre o tema. Esse é algo também uma grande iniciativa da OPS, que agora, por lo que entendo, vai ser uma iniciativa mundial. Ou seja, eu me acordo que quando começamos esse programa nas Américas, em los anos 70, final dos anos 70, um colega meu digo, por que não hacemos um rally interamericano? Eu digo, mira, isso é algo, uma visão muito grande, esse foi Steve Jones, e é algo que devemos seguir adelante fazendo isso. Bueno, se começou muitos anos depois. O Dr. George Allen, quando foi candidato a diretor da OMS, disse que uma de suas metas era ser uma campanha mundial de vacinação. Isso já há quase 20 anos, ou seja, e finalmente vocês agora han conseguido isso, ou seja, congratulações. Adelante, Alba.
Muchas gracias. Para esta presentación voy a seguir los siguientes puntos: objetivos de la semana de vacunación, antecedentes, resultados y progresos hacia una semana mundial. Bueno, en esta foto ustedes pueden ver ahí al diputado Zapata. Él muestra su liderazgo en todos los escenarios en Bolivia y también a nivel internacional. Entonces, este es un ejemplo claro de líderes como él que nos están apoyando en vacunación. Los objetivos de la semana de vacunación son promover la equidad y el acceso a la vacunación, promover la transición de la vacunación del niño hacia la vacunación de la familia, promover la comunicación y cooperación entre países y mantener la vacunación en la agenda política. En esta diapositiva ustedes pueden ver la evolución de la semana de vacunación durante estos 9 años, donde empieza en el 2002 como propuesta de los ministros de salud del área andina en respuesta al último brote de sarampión autóctono en la región, de hacer una campaña de vacunación en el área andina. Esta idea ha evolucionado y en el 2003, después de la primera experiencia de una semana de vacunación con 19 países, hubo una resolución del Consejo Directivo de Ministros que respaldó e invitó a los países a conducir una semana de vacunación anual. A través de los años ha habido diferentes énfasis para trabajar en proyectos específicos de eliminación o control de enfermedades, y también a la vez pueden ver ustedes cómo otras regiones del mundo han desarrollado iniciativas similares basadas en el ejemplo de las Américas. En el 2005 ustedes ven aquí la región europea que hace su primera semana de vacunación. En el 2010 tenemos la región de los países árabes, la región del Mediterráneo Oriental, conduciendo su primera semana de vacunación. Y en el 2011 tuvimos 2 nuevas regiones, que fue África y el Pacífico Occidental. Entonces tenemos 5 de las 6 regiones hasta el 2011. Quiero mencionar aquí cuál es la clave del progreso que ha habido en la semana de vacunación en las Américas, y es el proceso de planificación y compromiso de los países, y esto implica que se incluyan estas actividades en los planes nacionales de vacunación de los países con presupuestos propios, de tal manera que la dependencia de los recursos externos es muy poco y se asignan unos recursos internacionales para apoyar algunas actividades específicas, pero esto es financiado por los países. Y los países participan de una manera muy flexible, de acuerdo a sus prioridades nacionales y locales. Para eso se requiere un análisis de sus datos, de su información. Pueden decidir participar con poblaciones en municipios con bajas coberturas, pueden trabajar en áreas rurales, comunidades indígenas, poblaciones dispersas o grupos de riesgo ocupacionales, o pueden algunos países decidir hacer campañas de comunicación social, por ejemplo, para unirse en esa semana. Y a nivel regional, quiero destacar que este es un compromiso de la OPS desde la más alta gerencia hasta las oficinas de países, con todas las representaciones, los puntos focales, los equipos administrativos también, para poder desarrollar esta iniciativa y haber llegado a donde está hoy. Es un proceso, es una iniciativa de la organización, es mucho más allá que el programa de inmunizaciones. Para eso se ha dado una cooperación técnica a los países en el proceso de planificación y consolidación de sus metas. Se ha apoyado con el diseño de una campaña de comunicación, que ese ha sido un pilar, y aquí nos acompaña Ari Silva del equipo de comunicación. Ari, si levantas la mano. Ellos han desarrollado toda una campaña, diseño de materiales cada año, de videos, stickers, pósters, movilización de artistas, y se ha posicionado este proyecto en todas las comunidades de la región. Otro aspecto importante es la coordinación con socios, con otras instituciones, con embajadas, con Naciones Unidas. Hay una gran coordinación internacional para poder movilizar todas las personas pertinentes. Otro aspecto que también es clave en eso es la diseminación de la información, y los resultados de estas actividades están diseminados a través de la web, a través de foros, diferentes foros internacionales. A lo largo de estos años, los países han vacunado más de 350 millones de personas en las diferentes edades. Como ustedes ven, no solo niños, sino mujeres, adultos y todos los grupos de edad. Por eso hablamos de vacunación de la familia. Esta tabla no la voy a leer, simplemente para que ustedes vean la forma flexible como los países participan y deciden llegar o enfatizar uno de los ejes del programa o varios. Pueden incluir acciones para proteger los logros con sarampión o con polio, o completar la agenda inconclusa, o también incluir nuevas vacunas, por ejemplo, para atender nuevos desafíos. También es una plataforma para integrar otras actividades de salud, además de las tradicionales de vitamina A, desparasitación. Quisiera destacar, por ejemplo, Nicaragua, que utiliza esta oportunidad para registro civil de niños en todas estas actividades en las zonas remotas, donde se está llegando con la semana para hacer el registro civil de esos niños. Bueno, tenemos otras actividades, también destacar en el Caribe. Se ha hecho mucho énfasis en salud ocupacional, y dentro de esas actividades incluyen hepatitis B, por ejemplo. La coordinación de fronteras. Creo que esto es uno de los logros claves de esta actividad, porque se ha generado una coordinación binacional o trinacional de una manera impresionante a través de los años. Tenemos como un movimiento desde el norte al sur o del sur al norte. Aquí tenemos fotos de la frontera de México, Estados Unidos. Todas las fronteras realizan actividades. Este año, por ejemplo, hubo más de 30 actividades nacionales, binacionales o trinacionales. Bueno, y llegando hasta el cono sur. La visibilidad política. Hoy es un gusto contarles que muchos presidentes, cuando saben que se está haciendo un lanzamiento regional, piden estar en ese lanzamiento regional. Y esto es un impacto muy importante para el programa de inmunización, tener ese respaldo político. Aquí tenemos el presidente de Nicaragua, el presidente de Paraguay, el presidente de Panamá, las primeras damas, la primera dama de Surinam y altas autoridades de la frontera de Estados Unidos y México. La coordinación interagencial ha estado presente desde el principio de esta iniciativa, con la participación muy activa del CDC, de Canadá, de España, de UNICEF, entre otros. Y hay todo un compromiso de las agencias de Naciones Unidas con relación a la semana de vacunación y promoviendo la vacunación en general como un bien público regional. La comunicación social es un eje fundamental. Se ha creado una marca que se encuentra hasta los últimos lugares donde ustedes llegan, se puedan imaginar, se encuentra el mensaje de la vacunación, es un gesto de amor. Estos son materiales que se desarrollan cada año y estamos en las redes sociales como Facebook y Twitter. Bueno, aquí está Ricardo Montaner, que es el campeón de la salud este año y está aquí en Panamá, y entre otros. Se ha logrado una amplísima cobertura de prensa a lo largo de todos los países para destacar las diferentes actividades que están realizando en fronteras o destacando los logros que están haciendo con relación a la vacunación en cada país. Bueno, ¿y hacia dónde vamos hacia una semana mundial de vacunación? Como mencioné al principio, solo Ciudad está pendiente de unirse a esta iniciativa, pero ya generó un compromiso, el director de Ciudad y los equipos técnicos han estado trabajando para llegar el 2012 tener todas las regiones del mundo participando. Este año quiero decir que hubo 180 países unidos en esta semana de vacunación en un movimiento mundial de trascendencia muy importante en salud. Entonces, vemos cómo esta idea que nació aquí en las Américas ha llegado a comprometer y a generar esta energía positiva y de compromiso a todas las regiones del mundo. Ha implicado un proceso de planificación también y de apoyo a las otras regiones, con participación en talleres con todos los gerentes de país de esas regiones y también visitas técnicas aquí a la región como observadores. Tuvimos una visita dominicana, este año tuvimos la visita de Ciudad, del equipo de Ciudad, a Manaus, Brasil. También el equipo de KMC ha generado un apoyo importante en el diseño de materiales, de imagen y videos para documentar su participación. Aquí quiero mencionarles los eslogans que las otras regiones del mundo usaron este año. Por ejemplo, su eslogan fue soluciones compartidas a amenazas comunes. EMRO, la región del Mediterráneo, habló de alianzas estratégicas para la inmunización. África habló, ponga las madres y los niños primero, vacune y detenga la polio ahora. Y WIPRO habló un futuro saludable para la familia. Y la nuestra, que fue vacune su familia y proteja su comunidad. Bueno, Naciones Unidas nos dio un gran respaldo este año con la gran difusión que hizo a través de sus medios, dándole el respaldo a los 180 países que estaban generando este tipo de iniciativas. Y próximos pasos. Estamos, además del reporte que hacen los países, el reporte que hacen los países y el análisis de la contribución a la vacunación, de la semana de vacunación al programa de rutina, estamos haciendo 2 estudios de evaluación de impacto en cooperación con el CDC. Lo estamos haciendo en Paraguay y en Venezuela. Se está escribiendo un libro sobre las experiencias de la semana de vacunación en la región y también se ha estado trabajando con los grupos técnicos de la década de las vacunas, que es una presentación muy importante que nos van a hacer ahora para incluir este tipo de experiencias exitosas de la región en el marco de la década de las vacunas. Para formalizar la semana de vacunación a nivel mundial se requiere una resolución de la Asamblea Mundial de la Salud. Es un proceso que ya se ha iniciado, los países deben proponer en la Asamblea Mundial una resolución. En la Asamblea de este año, la ministra de El Salvador invitó a los ministros a generar una resolución. Ya hubo una propuesta en el plenario y la idea es seguir trabajando con la propuesta de los ministros, especialmente los ministros de las Américas que participan en el comité, para generar esta resolución. Y bueno, el año entrante estamos celebrando los 10 años de la semana de vacunación. Estamos atentos a todas las propuestas y construir un eslogan, un mensaje conjunto. Hannah Curtis les pasó en este momento una encuesta muy rápida a los jefes PAI es un ejercicio de una propuesta de un eslogan y poder consolidar con ustedes una propuesta final, como siempre lo hemos hecho. Hannah es la persona que trabaja muy fuertemente también en la iniciativa. Hannah, levanta la mano, la mayoría la conocen. Bueno, entonces con esto los queremos invitar a ver un video que preparamos para ustedes. Muchas gracias.
¿El video?
Comenzando aquí, en este lugar tan simbólico, tan alto, que es el pecho de nuestra América. Estamos en el sitio más alto donde pudiéramos reunirnos en todo el continente americano y en todas partes de nuestro continente. A partir de aquí, de la inspiración que surge de aquí, al lado del lago Titicaca, vamos a llevar y desempeñar en esta semana esta acción tan especial, esta intensificación, este llamado de atención con la colaboración de todos los medios, de la importancia de realmente hacer de la salud y de la vida un derecho para todos y todas.
La Semana de Vacunación en las Américas se celebró este año 2011 con 45 países y territorios de la región movilizados para lograr que 41 millones de niños y adultos se vacunaran contra enfermedades que son prevenibles. Esta fue la 9ª Semana de Vacunación en las Américas, una iniciativa que implica un esfuerzo extraordinario en la búsqueda por avanzar en la equidad y el acceso a la vacunación. Las actividades que se realizan durante esta celebración en abril cada año fortalecen los programas nacionales de vacunación en la región e identifican y llegan con vacunas a poblaciones que están aisladas o que tienen menos recursos.
Nosotros pensamos que el tema de la vacunación, igual que salud, es una corresponsabilidad y es bueno que las personas, que toda la población forme parte de esta tarea que es construir salud.
Uma grande parte da população do estado do Amazonas vive nas regiões ribeirinhas, nas regiões mais remotas, onde o governo brasileiro, junto com governos estaduais, municipais, faz um grande esforço para chegar até essas regiões. Só hoje, aqui no estado do Amazonas, a nossa meta é vacinar 500 mil de pessoas só para vacinação contra a gripe. E os povos indígenas, quase 100 mil povos indígenas, essa grande campanha de vacinação e imunização para todas as vacinas do calendário vacinal brasileiro.
En el 2003, lo que se inició como una reunión de ministros de las Américas para dar respuesta a un brote de sarampión fue el comienzo de una iniciativa que se ha convertido en una gran celebración de la salud y del panamericanismo, la Semana de Vacunación en las Américas. Gracias a un esfuerzo de promoción también a nivel mundial, en el 2011 otras 4 regiones, África, Europa, el Pacífico Occidental y el Mediterráneo Oriental, se sumaron a las Américas para celebrar simultáneamente sus propias semanas de vacunación. Más de 180 países y territorios en todo el mundo participaron este año en la Semana de Vacunación.
Что вакцина не только от полиомиелита защитит, но и укрепит иммунитет ребенка. Гунавшар Рахматуллоева через несколько дней собирается ехать.
Los países de las Américas han sido líderes a nivel mundial en la eliminación o reducción de enfermedades prevenibles por vacunas. Fue de las primeras regiones en erradicar la viruela y la polio, y siempre ha estado la región a la vanguardia en la introducción de nuevas vacunas y estrategias innovadoras.
En el Perú hace muchísimos años que no tenemos polio que no tenemos sarampión, y esto se debe a la vacunación.
Buscamos pues lo que es la salud de los niños de 0 a 6 años, sobre todo los controles de salud para esos niños, y eso incluye las vacunaciones. Así que para nosotros es muy importante la vacunación, tanto de los niños como los adolescentes pues, y los adultos mayores.
Durante estas jornadas, el objetivo es llegar a quienes viven en áreas rurales alejadas, comunidades indígenas, áreas urbano-marginales, para vacunar a miles de niños y niñas que nunca antes habían sido vacunados y para vacunar a aquellos que necesitan completar sus esquemas de vacunación. La voluntad y el entusiasmo se hicieron sentir de inmediato este 2011. En fronteras de todas las Américas, presidentes, primeras damas, alcaldes, ministros, trabajadores de la salud, artistas y voluntarios se comprometieron y movilizaron para hacer de esta semana de vacunación un éxito.
Saber que toda mi familia y yo estamos protegidos por las vacunas me llena de muchísima tranquilidad y de alegría. Y eso es lo que quisiera que todos hiciéramos. Adultos, hombres, mujeres, adolescentes, niñas y niños, adultos mayores, acudan todos al centro de salud más cercano. Así tendremos comunidades muchísimo más sanas. La vacunación es gratuita y es tu derecho. Y es un gesto de amor.
La Semana de Vacunación en las Américas se ha consolidado como una iniciativa de gran impacto para la salud en la región. La vacunación ha pasado a ser un bien público. Se ha hecho la transición de la vacunación infantil a la vacunación de toda la familia. Se han introducido nuevas vacunas, alcanzado otros sectores e implementado estrategias de atención primaria de salud. La Semana de Vacunación en las Américas se ha convertido en una herramienta para mantener los logros alcanzados en inmunización y servir de plataforma para introducir nuevas vacunas y reforzar vacunas subutilizadas. La coordinación interfronteriza ha servido para promover relaciones permanentes entre los servicios de salud, autoridades, líderes y comunidades. Más de 350 millones de personas, niñas, niños, adolescentes, mujeres en edad fértil, adultos mayores, han sido vacunados durante estos 9 años. El compromiso, dedicación y entusiasmo que cada país ha demostrado nace del profundo sentido del panamericanismo y de la convicción de que la salud, aunque es un derecho de todos, solo a través de acciones concretas y coordinadas, como la Semana de Vacunación en las Américas, es que este derecho puede hacerse realidad.
Esperamos que para el 2012, la región de las Américas, que fue donde se inicia la Semana de Vacunación, le haga el regalo al mundo en una semana de vacunación mundial.
La posibilidad de una Semana Mundial de Vacunación está cada vez más cerca de convertirse en una realidad durante el año próximo, para así beneficiar a millones de personas en todo el mundo en el contexto de esta lucha por llevar la salud para todos.
Extraordinario. ¿Comentarios? Bueno, nos quedamos mudos, que realmente el impacto es impresionante. Bueno, si no hay comentarios, pienso que realmente congratular a Organización Panamericana de la Salud por esa iniciativa y por ampliar eso a todo el universo. Eso realmente va a tener un impacto muy grande y pienso que en esa década de vacunas es algo también muy importante. Eso hace un buen pase entre esa sesión y la próxima presentación, que será hecho por el doctor Chris Elias de PAT, que es uno de los coordinadores de la iniciativa de la década de las vacunas. Chris.
It's okay.
Thank you. Thank you, Cyril, and thank you. Let me thank the organizers for giving me the opportunity to present a little bit about the Decade of Vaccines today. I also particularly want to thank Gina Tambini, who, in addition to suggesting that we include this presentation, has been serving on the steering committee for the Decade of Vaccines collaboration, and has also organized a discussion for later this afternoon with a number of you to have a more interactive input from, get your suggestions about, as we start the Decade of Vaccines collaboration, where we should be going about getting consultations from the various regions. Having the opportunity to participate here for the last few days has showed me that what I knew already, which is that PAHO has a tremendous amount of expertise and accomplishment, the countries here in the PAHO region, to contribute to other regions. I think we've just seen that with the video around the vaccination week, and how what began here has gathered momentum and will now, starting next year, be a World Week of Vaccination. Moving from the Week of Vaccination to the Decade of Vaccines, let me start by giving you a little bit of background. The beginning of this really was last year in Davos, Switzerland, at the World Economic Forum, when Bill and Melinda Gates issued a call for the next 10 years to be the, quote, decade of vaccines. Shortly after the call, I had an opportunity to joke with Bill Gates that he should have called it another decade of vaccines, because the last decade has been pretty impressive. And in fact, as Cyril has pointed out and mentioned in his presentation on Wednesday, this should really be called another century of vaccines, because if you look at the accomplishments over the past 100 years, particularly evident here in the PAHO region, of eliminating, eradicating smallpox, making tremendous progress on polio, measles, rubella, as we heard yesterday, on hepatitis A, et cetera, a tremendous range of illnesses that have been brought under incredible control with the use of vaccines and immunization. But when Bill and Melinda made that call last year, they based that call on a belief that vaccines were one of the most cost-effective public health interventions, and some data that had been produced for them by colleagues at Johns Hopkins University, that if we fully maximized the use of vaccines and immunization over the next decade, we could save 8 to 10 million lives across the world. And this was based on modeling that really just looked at using 5 existing vaccines, including the pentavalent, pneumococcal conjugate, and rotavirus vaccines, as well as an assumption that a 50% effective vaccine for malaria would become available midway through the decade. And those are, I think, fairly conservative estimates from my understanding of the modeling that Johns Hopkins has done. In making their call for a decade of vaccines, Bill and Melinda also committed their foundation to spending at least $10 billion over the decade of vaccines to help bring science and vaccines, to develop new vaccines, as well as to deliver existing vaccines to maximize their full potential. Shortly after that call in 2010, the leadership of the World Health Organization in the person of Margaret Chan, as well as UNICEF with the executive director, Tony Lake, joined with the Bill and Melinda Gates Foundation to try to begin to think about what would it take to have a decade of vaccines. Some preliminary planning and progress was made in 2010, and then at the end of 2010, WHO, UNICEF, and the Gates Foundation asked Pedro Alonso at the University of Barcelona and myself to co-chair a steering committee that would be responsible for leading the effort. And so we've, over the last few months, put together a secretariat, which is primarily housed out of Barcelona, but we're with some staff at the PATH office in Seattle, for what we're calling the Decade of Vaccines Collaboration. So just to be clear about the terminology, the Decade of Vaccines is meant to be the 10-year period beginning on January 1st of this year. The Decade of Vaccines Collaboration will be a time-limited effort during which the steering committee will work with the broad and diverse stakeholders in the immunization community to create a global vaccine action plan. And we aim to do that by the middle or third quarter of 2012. So what we've just begun to do is to establish a collaborative structure to engage diverse stakeholders, and this is really one of the first opportunities to reach out to an important region that has been working in vaccines for a long time to tell you what we're planning and to get your input. The vision of the Decade of Vaccines is that we envision a world where children, families, and communities enjoy life protected from the threat of disease. The purpose of the Decade of Vaccines is to extend the full benefits of immunization to all people, regardless of where they live. Now, what you'll see in the wording of this vision statement is something that's already very much a part of the vision of vaccines. It was reflected in the video about the vaccination week here in the Paho region. And that is that this is an intentional effort to go beyond just thinking about improving coverage for infant immunization and to really extend the benefits of immunization to families and communities in a more holistic way. It's also an effort that's focused on all the people in the world. So it's not just an effort to improve immunization coverage or introduction of new vaccines in Gavi-eligible countries, but also has a very intentional focus on lower and middle income countries as well, something that we haven't always seen as we've talked about visions for vaccines and immunization. Why now? We really feel that this is a unique moment in time that we can seize to turn into a movement. And I think, again, over the last few days, I've seen evidence that there's already a considerable amount of momentum in this region toward that movement. And we've seen evidence presented from studies in a number of countries as you've shared your experiences. There are new vaccines that are ready for country introduction. We have a path with the World Health Organization. We've worked on a new meningitis A vaccine that we were able to introduce in West Africa at scale earlier this year. There are new vaccines for HPV, for cervical cancer prevention, for pneumonia, for diarrhea. And we've also heard that there are excellent candidates in the pipeline for new vaccines. We heard yesterday about progress being made in the science of dengue vaccine development. We're very optimistic at PATH that our malaria vaccine initiative, which has an important collaboration with GlaxoSmithKline on the RTSS vaccine, which is now in final phase 3 clinical trials in 7 different African countries. We're hoping that if all goes well by that, with that, we may have the first malaria vaccine by 2015. And there's new science, even in areas as difficult as HIV. Some of the new science on neutralizing antibodies has brought some new hope into vaccine development, even for those very difficult diseases. So over the next decade, I think we're going to see science truly revolutionize or further revolutionize the potential of saving lives with vaccines and immunization. Most importantly, and perhaps most evident in this region, is that national governments are prioritizing vaccines in their health strategies. Representative Zapata's final slide, which stayed up there for a while, of the changes in budget in Bolivia are emblematic of that. That's the kind of political commitment and financial commitments and sustainable immunization services that we've not seen yet in all regions and that we need to see everywhere, really, by the end of the decade. So we're seeing more resources, more political commitment, et cetera. So we do think this is a unique time to work together with all of you and with the broader global immunization community to articulate what the roadmap would be for the decade of vaccines. Our collaboration, as I mentioned, is a time-limited effort to develop that roadmap. It will be, in that regard, one of the first major steps in the 10-year decade of vaccines. And our efforts were really launched this year at the World Health Assembly, where a paper was presented. The World Health Assembly was was expecting on schedule to have an update on the global immunization vision and strategy. And as part of that update, WHO provided not just an assessment of the first 5 years of the GIVE strategy, but also introduced the notion of the decade of vaccines, talked about how that could be used to extend and to expand upon the successes of the global immunization vision and strategy. And what was notable at this year's World Health Assembly is that over 55 countries and a range of other partners made interventions related to that paper. In fact, 5.5 hours of discussion was dedicated to discussing the global immunization vision and strategy and the decade of vaccines, representing, I think, tremendous enthusiasm among the member states of the World Health Organization, and a number of the PAHO countries were a part of that, those comments that were made at the World Health Assembly. That's really where we began the discussion of the decade of vaccines, and we've got a busy year ahead of us because our commitment is to bring back to the World Health Assembly for their endorsement and review at next year's World Health Assembly the Global Vaccine Action Plan. So we're gearing up over the summer to do that. This is the structure of the Decade of Vaccines collaboration. There's a leadership council, which I'll show you in some more detail in a moment, that provides overall guidance and will ultimately review the Global Vaccine Action Plan that is being developed by the steering committee. We will also be forming an international advisory committee that's not yet impaneled, which will be a group of high-level ambassadors and spokespersons for the Decade of Vaccines collaboration and the Global Vaccine Action Plan. We saw some of the importance of that type of ambassadorial leadership in the video that we just saw. The steering committee, I'll show you in a minute, is basically comprised of two types of members. There are the co-chairs of each of the 4 working groups of the Decade of Vaccines collaboration, which include public and political support, delivery, research and development, and global access. And I'll show you who those folks are in a minute, as well as a number of at-large members of the steering committee. And we're very happy to have both Ciro and Gina Tambini participating as at-large members of the steering committee for the Decade of Vaccines. There's a secretariat, which, as I mentioned, is mostly housed in Barcelona, but with some presence in Seattle that will help to pull together the actual plan that will be presented to the World Health Assembly and to other stakeholders. The Leadership Council for the Decade of Vaccines collaboration is comprised of Margaret Chan, the Director General of the World Health Organization, Mr. Tony Lake, the Executive Director of UNICEF, as well as Tony Fauci, the Director of the National Institute of Allergy and Infectious Diseases in the United States, and Tachi Yamada, the President of Global Health at the Bill and Melinda Gates Foundation. Now, as I think many of you know, that Dr. Yamada stepped down from his position at the Gates Foundation 2 or 3 weeks ago, and so on the interim basis, he's been replaced by Rajiv Venkaya, the Director of Vaccine Delivery at the Gates Foundation. And the final member of the Leadership Council is Joy Fumafi, who will be the chair of the International Advisory Committee as we put that together. That Leadership Council essentially serves as a governing body for the 19-member steering committee pictured here, co-chaired by Pedro Alonso and myself, and with the other individuals mentioned. I won't go through each one of them. As I mentioned, both Ciro and Gina are participating. We've also tried to bring some of the other key organizations engaged in vaccines and immunization into the steering committee. So, for instance, Dr. Ann Schuckert from the CDC participates actively, as well as Helen Evans, who's been the interim director of Gavi, et cetera. Just to go through the 4 working groups briefly, and then to take any questions you may have. The one group I'll go into a little bit more in detail, just to give you a sense of some of the work that's being done by the working groups, is the delivery working group, whose charter is to prevent, eliminate, or eradicate diseases by means of achieving high and equitable coverage with effective and safe immunization along with other essential healthcare interventions. As the delivery working group has begun its work, one of the key themes that's coming out in that work stream is the importance of integrating efforts for the control of vaccine-preventable diseases with other more comprehensive primary health care programs, diarrheal disease programs, acute respiratory infection control programs, etc. This working group is co-chaired by Dr. Okwo Bele from the World Health Organization. Okwo, as you know, I think leads the Vaccines and Biologicals Division at WHO in Geneva, and Jos Vandeleer, who leads the vaccination efforts within UNICEF. Their scope will be to build upon the current global immunization vision and strategy, and to extend it. It's currently, the current strategy goes through 2015. It'll be extended to 2020. To help ensure country consultation and engagement, as I'm talking here to you, later this summer, Jos and Okwo will be attending a number of other regional WHO EPI managers meetings and UNICEF meetings to have similar conversations, to develop recommendations for improving immunization systems as a platform to prevent morbidity and mortality, and to create, importantly, to create cost estimates for the financing of the delivery of immunization services. One of the goals, as I mentioned earlier, of the Decade of Vaccines will be to foster the kind of commitment, financial commitment to the sustainability of immunization services that we've seen exemplified in some of the presentations over the last couple of days, and to see that kind of commitment in other regions where often, as the Sabin Institute has documented in their sustainable financing project, in some countries in other regions, the costs of the immunization delivery are totally off the books. The ministers of finance don't even know what it costs. And not knowing what it costs, it's very hard to build in the support into budget lines. In talking with the delivery team as they've progressed in their work, some of the critical success factors that they've identified are that universal demand for immunization is met through the adoption of the general measures of implementation of a human rights-based approach. It's been clear to me in the last few days listening to the variety of presentations that this idea of immunization as a human right is very well embedded in the countries of the PAHO region and reflected, as we saw this morning in Carr's presentation, in many of the laws of this region. That's not the case in many other regions. And as Ciro described, again, the Sabin Institute is beginning in an effort to transfer some of that experience from this region to countries in Africa and Asia. That all relevant stakeholders at local and national levels need to be mobilized and committed to immunization. Again, I think the video we saw this morning gives us a very good indication of the value of getting everyone brought in as stakeholders for the success of immunization programs. To see that immunization services are expanded and incorporated into the broader healthcare system. One of the things that's come out clearly in the various consultative meetings held by the delivery working group to date are the kinds of challenges that were highlighted by our colleague from Panama in talking about the HPV vaccine on Wednesday, that there's a limited number of healthcare workers, and as we bring more and more vaccines to bear on a system, we need to invest as much in the development of that system for delivery as we invest in the research and development to produce the high-quality vaccines, test them, and get them registered. And so paying attention to some of the critical human resources challenges, the cold chain challenges, the other systems challenges that are often invisible when we talk about making the evidence base and creating the evidence base and creating the financial capability to introduce new vaccines. And then finally to have accountable management and decision-making processes that are functioning. One of the things that each of the four working groups, and I'll only show you this for delivery, we can talk later this afternoon in the smaller group about some of the other groups if you'd like. One of the things that the steering committee asked each of the four working groups to do was to talk about what the current state is and what the desired state would be by the end of the decade, and that use that as a mechanism for identifying some of the gaps. And so I'll just show you in this slide and the next what the delivery working group has done in terms of that current state, desired state comparison. In many parts of the world, immunization is considered a service rather than a right. It is still missing 23 million children a year, is the estimate from UNICEF. It's not engaging civil society or other key stakeholders to any extent, and is focused almost exclusively on public sector healthcare providers. By the end of the decade, we'd like to see a situation where immunization is demanded by all communities and seen as a right, that it reaches all target populations, that it mobilizes and commits all necessary stakeholders, and that it engages all needed healthcare providers. Continuing that description of current state, desired state, and I think this, as I reviewed this morning, I realized that, again, the PAHO region has a tremendous amount to offer in terms of learning, because you've already moved quite a distance in many countries from what we're describing here as the current state globally to the desired state by the end of the decade. And I think one of the things, as someone personally who spends most of his time in sub-Saharan Africa and in Asia, and not so much here in the PAHO region, my impression after 3 days of hearing about the wonderful successes of the programs of this region has been that your success is really a pretty well-kept secret from other parts of the world. And I think bringing forward some of the experiences that you have, as Ciro described, that Sabin is doing with some of the legal frameworks, is going to be very important to realizing this vision of the decade of vaccines. Because in many places right now, immunization programs are deficient in their data collection and consequently don't have the right data necessary for analysis and use in decision making. It's often very much a vertical program with its own resources and systems and not well integrated with other primary healthcare efforts. It's often slow in the uptake of new vaccines and technologies, and we've seen a constant series of resetting and missing of targets for eradication and elimination. Whereas by the end of the decade, we'd like to see that evidence-based decision-making informs policies and priorities and actions, including financial commitments globally in the area of immunization, that we work seamlessly within that broader health system and find those synergies between what are now often very segregated vertical programs, and that we rapidly introduce and sustain new and underutilized vaccines and technologies to a wider scale. Just to give you one example from our work with the meningitis A vaccine in West Africa, we've seen a tremendous change, I think, in spirit since we took about 10 years for the PATH WHO collaboration to develop an affordable vaccine for meningitis A. It was just pre-qualified in about a year ago, last July. And it was then introduced in the fall of 2010 at scale in 3 countries, in Burkina Faso, Mali, and Niger. Really one of the first times that a vaccine was brought into some of the poorest countries of Africa within months of its pre-qualification. And we were able to, through our collaboration with the Ministry of Health of Burkina Faso, and led really by WHO, to immunize 99% of the 1 to 29 year-old population in Burkina Faso. And as a consequence, in this year's meningitis season, Burkina Faso, which has had hundreds or thousands of cases of meningitis A for as long as it's been recorded, this year had only 4 cases of meningitis A, and none of those were in immunized individuals. That kind of result of being able to bring new innovation quickly into scaled delivery has re-energized many of the African programs that we've been talking about. And I think, again, sharing your experiences with the prompt introduction of new vaccines for rotavirus, for pneumococcal conjugate, whereas Ciro said on Wednesday, really some of the first efforts were here in the PAHO region. I think those are efforts we need to share more broadly. Let me just run through quickly the scope of the other 3 working groups. The Public and Political Support Working Group is co-chaired by Dr. Nicole Bates from the Gates Foundation, as well as Peter Singer from the University of Toronto's Center for Global Health. And they're leading an effort to strengthen public and political support for vaccines, specifically trying to facilitate a networking, a better connection between the academic and advocacy communities around a shared agenda, to synthesize key foci related to the existing evidence base. How do we, there's a science, if you will, to understanding how we gain public and political support and how we resist some of the not evidence-based resistance to vaccines and immunization that we heard described a bit yesterday. And then also this working group will advise the other members of the Decade of Vaccines collaboration in terms of their advocacy strategies related to delivery and research and development, et cetera. The Research and Development Working Group is co-chaired by Dr. David Salisbury from the UK Department of Health and Seth Berkley from, until last week at the International AIDS Vaccine Initiative. Seth will be the new CEO of Gavi starting in early August. And the effort of the R&D Working Group has really been to understand how to maintain a strong pipeline of research and development to ensure that vaccines will improve the lives of children beyond this decade. I think Ciro's characterization of this decade as simply the first 10 years of the next century of vaccines is probably the right perspective, especially as we think about some of the more challenging diseases like HIV that are going to require a longer timeline of research and development in terms of developing new tools. The R&D effort will seek to rationalize the balance between priority vaccines based on objective criteria of need and the feasibility for product development, to identify a process for translating the working group outputs and recommendations into funded research projects and programs, and to come up with a rough costing of the outputs and recommendations in terms of the research and development agenda. Finally, the Global Access Working Group, co-chaired by Dr. Lauren Levine from Johns Hopkins University's International Vaccine Access Center, and Sandy Roble from Applied Strategies. Their charter is to develop the part of the action plan that will help to ensure that we have global access to an adequate supply of high-quality, affordable vaccines with formulations and presentations that meet the needs of people in all countries. And again, I think there's much to learn from countries here in the PAHO region in terms of building the regional capacity for development and manufacturing of vaccines through technology transfers. We've heard a couple of times through this meeting. They have three subgroups, if you will, that are working on specifically on efficient and effective supply procurement strategies, and in that regard, we'll be looking very closely at the revolving fund of PAHO. They're working closely on affordable pricing strategies. One of the, I think, best pieces of news this year has been the announcement that a number of countries made, both developing country manufacturers and multinational manufacturers made the week before the Gavi Pledging Conference about the significant reductions in the price of vaccines for poor countries, and thinking with the industry how we can come up with pricing strategies that allow them to stay in business, but also to make their vaccines more affordable to a broader range of people over the course of the decade. And then to look at comprehensive financing strategies, both approaches to meeting the projected financing needs and including in that how to build support in national budget lines for financing of immunization services, and approaches to getting a greater return on the available financing, including some attention to operational research for improving the efficiency of immunization delivery services. And part of this working group will also be to look at better improved demand forecasting methods and tools so that we can send the right kind of signals to industry about the types of products and scaling of manufacturing facilities, et cetera. So transitioning toward the end here, one of the things, the purpose of this was to really primarily informational to tell you what we are starting to do and to seek your input, because the consultation is an important pillar of the Decade of Vaccines, and really our success will be determined to some extent by how effective we are in getting everyone's input, so that when there is a a global vaccine action plan, and it's endorsed by the World Health Assembly and other stakeholders, and the Decade of Vaccines Collaboration Secretariat goes off into the sunset, that there's a plan that doesn't just sit on a shelf, but is in fact useful to people in informing their actions and budget decisions, et cetera. We'll be doing regional consultations in really all of the WHO regions. We anticipate by probably end of September, which is the time of our next steering committee, that we'll have a first draft of the Global Vaccine Action Plan. Each of these working groups, which has diverse representation from different countries and regions and institutions, will be working over the summer to come up with a first draft, which we will then bring to each of the regions for consultation, and we're in the process of designing that consultative process, so it would be helpful to know from your perspective what would work best, and then ultimately bring that into a final draft of the Global Vaccine Action Plan to send to the World Health Assembly in advance of its meeting next May. I won't go through this in detail because I've talked through most of this. These are just basically reflects some of the types of things that each of the four working groups are aiming to do. The critical success factors from our perspective are that we foster an active participation of the entire international vaccine community to define and then subsequently to execute a comprehensive effort to improve and save lives through vaccination. That we come up with a global vaccine action plan that turns the Decade of Vaccines vision into a reality over the next 10 years, and that we ensure the continued engagement of people like yourself as well as other stakeholders and individuals who are committed to the plan's implementation and ultimately committed to saving the 8 to 10 million lives that are savable over the next 10 years through the prevention of vaccine-preventable disease. Part of the longer vision statement, which you can see on our website, which I'll show you on the next slide, points out that access to safe and effective vaccines is a human right that is not currently enjoyed by everyone, particularly in low and middle income countries. And in this decade, we have the opportunity to revolutionize global health and save millions of lives. The quote here is from Margaret Chan. It was really her endorsement of the call that was made in January of 2010 by Bill and Melinda Gates for the Decade of Vaccines. These are the websites which are just being populated. I encourage you to visit there. You can send an email there, or you can follow us on Twitter. We're beginning to use social media for this effort as well. So thank you for your attention. I'm happy to answer any questions.
Thank you very much, because I think this was a very clear presentation of what this collaboration means and what aims at. And the most important part, as you mentioned, is this consultation with countries so that we have input of all those that will be actually implementing this global action plan. La presentación de Dr. Elias es abierta para discusión y para comentarios. Arlene?
Yes, thank you very much for the presentation, and I pose a potential challenge to you. In light of the preceding presentation, whereby in 2012 we're going to be launching the first global immunization week, and the global vaccine action plan is to be completed in 2012, I wondered if you had given any thought to, or could give thought to, having some linkage between those two events and activities to serve as the launch for the action plan. Thank you.
Yeah, I can answer that. We're under, maybe I should just quote Margaret Chan's perspective on this, that we argued that we should take more time, and that, because in order to get to the World Health Assembly to have a report and resolution for the Global Vaccine Action Plan at the May 2012 World Health Assembly, we have to actually have documents ready for countries by pretty much the end of February of 2012. And so we were arguing that, well, maybe we should take a little bit longer. And Margaret's position, which I think is reasonable, is that if we're going to have a 10-year period of the decade of vaccines, we shouldn't spend the first 3 years planning it. And so she's anxious that we move forward with speed. So we'll do the consultations beforehand, but then the global vaccination week will fall, as I understand it, in that period between when the documents have to be already submitted to the World Health Assembly and when they'll be reviewed and discussed in Geneva. So what we would hope is to use the Global Vaccination Week as a time for getting countries to really engage in that plan, to look at it, to consider it, to debate it, so that they come very well prepared to the World Health Assembly. We saw this year, I think, the level of interest with 5.5 hours of discussion in a very busy World Health Assembly agenda. And so I think we'll expect that more. So we will certainly, we'll have by then, if you will, an advanced draft that will be under consideration at the World Health Assembly. And we'll certainly use that to gain the visibility throughout all the regions of WHO, since it will be a global vaccination week next year, to have the member states engage with the plan so that they come prepared to the World Health Assembly.
Akira? Thank you, Mr. Chairman, and thank you for a very nice presentation. I just have some, I would like to have some additional comments on the issue related to microphone. Okay, yes. Further comment or elaborate a little bit more on what you say about global access and delivery, because you are touching, you are showing that you will deal with the existing vaccine and also new vaccine, new and important vaccine, and dengue, such as dengue, malaria, HIV, TB, and how are you thinking to have it possible to have a global access? Because the vaccine takes a long time for development, and to make it available, the industries must come with new and big investment to having a huge plant to make it available for everybody. We heard about cholera vaccine, which for more than 8 years is working this, and I know we have already technology today, but it is not available because industry need to have a guarantee of demand and to make investments on. And I know that you all know that the development takes a long time, but production also takes a long time because investment in the new facility and coming with a new product registered by the regulatory authority also takes a long time. And I think you're right. It's not decade of vaccine. I think we are talking about century of vaccine. No? Thank you.
You're right, Akira, in terms of you can't get it all done within a decade. So for the research and development agenda really is, to some extent, the agenda for this decade and beyond. The way that David Salisbury is organizing the R&D working group is to look at 3 different, if you will, epics for research and development. One is the sort of near-term, really operational issue about how do we take vaccines where we essentially have current proof of concept and address some of the issues of scale-up, of better demand forecasting, so that, again, the industries have the signals they need about how big of a manufacturing facility, et cetera. So a sort of next 4 years research and development agenda, a sort of 3 to 8 year agenda, which is really taking sort of translational science, where we would be pursuing, if you will, second generation lower cost vaccines for some of the targets where we currently have high price vaccines. And then a third epic of research and development, which is really about scientific research and development that needs to be done this decade for vaccines that will become available in the next decade. An HIV vaccine would be an example. A highly effective malaria vaccine is probably in that category. So the Research and Development Group, which is again just beginning, is scoping out its work to try to deal with some of the nuances of what you mentioned in terms of some research is fairly near-focused, but some is pretty far-focused, and really is about the agenda that will bring us into the next decade.
¿Algún otro miembro? Sí, Jeanette.
Yeah, referring to your sentence on we having best kept secret on how to be successful, I think that one of the issues that is very key in this continent is that we introduced the vaccines on working health systems. And because we have a long history of health systems mostly delivering it through primary health care, following the sort of the Alma Ata declaration, it's very different, the situation than, for example, in Africa, where what you basically have is you have a bunch of donors competing to get their programs there and with the same people. So I've been working in Africa, and what you find is that every time that you go, the technical people from the Ministries of Health are in some sort of capacity building or workshop with one of the donors that are trying to advance their own agendas. So I think that there are some structural issues related to making your art, making the donors to understand what are the issues, and then I don't see an effort like that being successful unless you connect with the strengthening health system part. Even if you develop the best vaccines in the world, you're going to have issues related to implementation. Yeah.
I couldn't agree more. And in fact, a lot of the work in the various meetings that the Delivery Working Group has had has been bringing forward that lesson that where if you look at the most successful programs in terms of either coverage of existing vaccines or introduction of new vaccines, it's really in places with stronger health systems where the vaccine, the immunization efforts are better integrated into broader primary health care initiatives, better integrated into comprehensive disease control efforts for, say, diarrheal disease or pneumonia, where vaccine preventable illness is only one important portion of the disease burden. So that lesson is being brought forward, and that's I think that will be one of the more challenging recommendations of the Global Vaccine Action Plan, because, as you mentioned, historically some donors have really, for one reason or another, been afraid of health system strengthening and more interested in this sort of technology-focused introduction. But I think the experience suggests that you can't do one without the other.
Just a minor comment on terminology. We are trying to avoid the word donors in all the documents of the decade of the vaccines and in any document of WHO and PAHO, because there are really no donors. Nobody is really giving anything. This is a support, this is an investment that countries, richer countries do, and that will benefit them so that everybody gains. And actually the word donor, makes almost eternal this dependency and paternalistic way. So because if you have a donor, you have someone asking for something. And we have to change this paradigm. And actually in the Pacific Health Summit just about 2 weeks ago. There were in the last panel when Margaret Chan was there, she emphasized that we have to stop that, and I think that is something that we should not perpetuate. I follow and I agree extremely much with Dr. Georgia Lin, the former director of PAHO, that started this kind of movement to change this paradigm from paternalism to country ownership, and one of the things we have to do is to stop calling these people donors, because they are not really donors. They are partners and they are development agencies. So,
Chris, I thought that was a wonderful presentation, and in this session we went from the week of vaccination to the decade of vaccination to the century, so we have to think in the long term. Several things that to me need clarification. One was, in this session, we talked about the issues of regulatory science, and both at the national and regional levels, as well as within companies themselves. And that's an area which always is overlooked and is absolutely critical, and we see in our own cholera discussions, it's the regulatory issues on both sides, the regulators and the company, that requires attention. And I didn't see that in the plan, but it's got to be there. The other area was in human resources and training, because that's something that's always been left out as an area and around the science of vaccinology. And finally, I think the most compelling argument for what PATH has done with WHO with a meninge vaccine was the decision to not go with an existing multinational, but to set out a price level and then choose to get a price that would be usable and affordable. And as I see us discussing vaccines like HPV, papilloma, the malaria vaccine coming, the new dengue vaccines, that we're either going to enter a system where new vaccines come out at a high cost and we work for a decade to get the cost down, or we approach it with emerging manufacturers and some price window where we say that if these companies are helped, as in your malaria venture, that the price of vaccine that comes out the tail end for the low-income countries will be an affordable vaccine from day one. I know when we look at rotavirus that it's that cost window for Latin America, which is reasonable, which is unreasonable for the African countries, and there's been a change there. So the costing and how you proceed.
Great points, Roger. A couple of comments. First, on regulatory science, you have to choose a structure. We chose the structure for the working groups that we have, and then as a steering committee, we recognized that there were a number of cross-cutting issues that needed specific attention. Regulatory science being one of them, cuts across really between the research and development, the global access groups, and so Lee Hall from the NIH, who's one of the members, one of the at-large members of the steering committee, has taken responsibility for coordinating a sort of cross-working group discussion about regulatory science. So we're not going to lose sight of that. The training is coming out in the delivery discussions about how do we strengthen human resources as a critical component of strengthening health systems in order to support expanded immunization services. So I don't think that will get lost either. I think your point about the approach PATH and WHO took to the meningitis vaccine is important, but it's also important to recognize the limitation. In that case, we had and there will be many other examples where the science was proven. There was no question about whether a conjugate vaccine would work if we got the right technology and developed it. So we didn't need any proprietary. The intellectual property was licensed from NIH and then sub-licensed to the Serum Institute of India. There was no complex intellectual property arrangement. So when we can, if you will, set a very strong target product profile that includes a a price target for affordability, which as you know, we've done with the second generation rotavirus vaccines with several collaborations. We will certainly recommend doing that. But I don't think we want to lose sight of, particularly for some of the more difficult science, that some of the components of a successful first generation vaccine, whether they're adjuvants, neutralizing antibody, there'll be intellectual property that will only be held in the multinationals. So we don't want to lose sight of their potential role in scientific discovery and technology development. So we'll try to capture all of that dynamic in the research and development working group, but I think we want to avoid saying there's just one model that we should be using.
Jose Ignacio?
Thanks. That was definitely a very comprehensive presentation. And not to reiterate what Janetta has already said, in terms of the metrics that are going to be used for measuring success, now that we're thinking not of a decade, but maybe a century or a millennium, I mean, where are the benchmarks for this?
Thanks, Jose Ignacio. That will be part of the the final product will be not only to say what we feel needs to be done, but how we can measure success over the course of this decade and beyond, perhaps. A millennium of vaccines I can't think about. But so that we're really just at the beginning, so we're still at the sort of defining what the roadmap is, but certainly before we finish, defining what the metrics of success would be. And this is where I think, as Roger said earlier this morning, we're going to see an incredible revolution in information and communication technology over the course of this decade that will potentially allow us to have, the kinds of registry systems and adverse event tracking, safety, as Philip mentioned. All of those things should become easier to do by being enabled by more accessible and lower cost and more interoperable information and communication technologies. So I take your point that the metrics will be important, and it's certainly on the agenda of the steering committee to define those before we finalize the plan to send it forward to the World Health Assembly.
John?
Yes, thank you, Dr. Ellis. That was one of the most comprehensive and clear presentations that I've seen. And on behalf of Dr. Shukett and others at CDC, thank you for reaching out to them. They're really excited about participating in that. It occurs to me that one of the linchpins for success will be reaching out to countries and how these working groups interrelate with countries and engage with countries. And like Jeanette has mentioned, we would agree that PAHO is, it's the best kept secret in the world. But I think there's also an elephant or two in the room, and that's polio eradication, that's measles. While we've met here this week, there's a P3 virus circulating in Pakistan. So continuing delays or worse of polio eradication, not recovering from the measles outbreaks, could throw cold water on this excellent opportunity. So we would encourage the leadership to really push push us and the other key agencies to finish these jobs.
I couldn't agree more, and I think it's true. I know from conversations at the Gates Foundation where they recently told me the number one priority was polio eradication, the number two priority was the decade of vaccines. So they certainly see finishing the polio eradication and adding their resources as well as mobilizing others as very much tied to the ultimate success of the decade of vaccines. I think that's shared also by WHO and UNICEF at the leadership level. The question, I think, the biggest risk, as I see it, goes again to the fact that we have limited
capacity in health systems in some of the most critical geographies, so that we can, it's easy to say we have to do both this and that, but the people who have to do that are really stretched at the ground.
We have still several interventions. Gina?
Gracias Cris por estar con nosotros estos 3 días. Realmente ha sido una gran oportunidad que puedas tú directamente mirar la experiencia de los países de la región. Dos retos que quiero lanzar a los compañeros de países, sobre todo en relación a los mensajes que han salido de esta presentación y comentarios previos. Ante todo, me siento honrada realmente de poder tener esa oportunidad de contribuir en la colaboración por la década de vacuna, con base a esa experiencia ganada en el trabajo con cada uno y cada una de ustedes en más de 20 años de trabajar en la región. Primer reto, nos lo han dicho y lo he repetido acá, que somos un secreto muy bien guardado. Ya estoy retando también a mis colegas del equipo de inmunizaciones y ahora para ustedes también este desafío, que necesitamos hacer más visible lo que hacemos y sobre todo no solo los resultados, sino el cómo lo hemos logrado. Entonces yo creo que ahí hay mucho que podemos nosotros aportar porque esto va a servir para otras regiones y también sirve dentro de nuestra región para otros programas. El segundo reto, y lo hemos discutido, el doctor de Cuadros que también participa del Steering Committee, la necesidad de tener mayor presencia de profesionales, de personas de nuestros países, de los países en desarrollo y sobre todo de países de esta región. Entonces ahí les diría, ustedes han escuchado de los 4 grupos de trabajo, pensar en nombres y ayudarnos a Cuauhtémoc que a mí nos mandan email, en la lista de participantes van a tener nuestros email para poder nosotros mirar eso y proponer a los coordinadores de los grupos de trabajo porque realmente necesitamos estar presentes en esos diferentes grupos de trabajo y en otros foros.
Gracias. Lynn?
And in recognition of the best kept secret, and just a few other comments, and in recognition of what my colleague from CDC just said, I think that as a suggestion or a thought, yet again, is looking at the way the agenda was laid out for this meeting might be a way of thinking about the way one might develop a global vaccine action plan, talking about maintaining the achievements, some of the issues related to the unfinished agendas and new challenges, as well as, looking into the future in terms of research, development, and use of new vaccines, so that it is acknowledged that part of saving all of those lives will require attention to the unfinished agenda and some of the new challenges that we face.
John?
Thank you, Chris, and that's outstanding. And I'm really encouraged to hear what's being done. I might say, well, 2 things. One is that you have the total support of our director, already exhibited by Gina's participation, but as things come up, you have her total support. I can say that with complete confidence. I would, just to throw another thing on the table when thinking about how this is couched, I might suggest that it be the decade of vaccine impact. That gets back to points that others have raised. And the example where in Africa the measles initiative over such a short period of time saved 13 million lives, and now we're stuck with not sustaining that. And there's such a political commitment there. And I say this personally because some 25 years ago I was a district medical officer that had a measles ward, and then to go back 20 years later and see the ward shut down during this period from 2000 to 2006 was extraordinary, and I think it's a missed opportunity and gets back to the impact, the real impact, and impact whether it be capacity, impact on mortality reduction, and all the other things that I think that Arlene was getting to too.
John?
Chris, just thought about equity. Equity is not only a matter of the price of the vaccine, but equity is a matter of who has the manufacturing capacity, as was proven in 2009 influenza vaccine. And so I think, and I haven't heard much about thinking about this, I think we have to think, especially as we come up with new vaccines, especially as we come up with an HIV vaccine, that the equity in TB vaccine, the equity of getting that vaccine into the population in an equitable manner is a crucial issue. And it was raised by Gates in their review of the 2009, how the 2009 pandemic was handled.
You want to comment on that?
Just that I would agree, and the developing, as Akira can say, in greater detail, developing that capacity for manufacturing is not something that is usually measured in years. It's usually measured in decades, but it's something that needs more attention and more focus. And I think, as you know, some of our flu efforts at PATH are very much focused on how can we have technologies that are more easily transferred. I'm hopeful, Akira can tell me if I'm right, to be hopeful that some of the new technologies that are being developed for manufacturing may make it easier over time to establish new manufacturing facilities. But that's one hope that's counterbalanced by a trend in the regulatory environment that goes towards more and more regulation, less and less tolerance of any kind of safety signal. So I'm not sure it's going to get easier as some have hoped. But it's certainly part of the agenda. How much can get done in this decade? I think we need to set reasonable expectations.
Thank you. Any final comment? So I think then we completed our agenda half an hour ahead of time. So we'll have a longer lunch time. Thank you again, Chris, for this outstanding presentation and the introduction of the collaboration here in the PAHO region. And as John said, I'm sure that you will have a tremendous collaboration of all countries and all individuals that could be called upon to collaborate. I understand that after the end of our meeting this afternoon, there will be a continuation of this consultation with a smaller group of country representatives so that you can go deeper into how the region could collaborate on this effort. So then the meeting is adjourned until 2 o'clock in the afternoon. Is any announcement to be made now? Yeah, so. But anyway, we will meet together here for the final session at 2 p.m. Nos encontraremos acá a las 2 de la tarde para hacer la sesión final. Cuauhtémoc va a hacer algunos anuncios.
Gracias. Desafortunadamente, algunos vuelos han sido cancelados por problemas estos ligados con el volcán y todo esto. Los vuelos que sabemos que están cancelados hasta este momento son el vuelo de Air Canada, que es el AC-093 que va a Toronto esta tarde, el de United, que es el 846 que va a Washington, el de American Airlines, que es el 996 que va a Dallas, y el Continental, que es el CO52 que va a Houston. No, desde luego no todos ustedes están en estos vuelos. Los colegas que estén en estos vuelos, por favor, se acercan aquí con las compañeras que están aquí en la entrada para que tomemos las previsiones suficientes. Nosotros estamos viendo el asunto de la reservación del hotel, los que tenían que salir hoy. No hay ningún otro vuelo cancelado, los otros vuelos están abiertos. Para mañana no tenemos ninguna información todavía, todo esto va cambiando. También informarles, más tarde les diremos, en el supuesto que esto se prolongara y que afectara otros vuelos, nosotros informaremos a ustedes qué medidas vamos a tomar para garantizar su hospedaje, alimentación, facilitar esto. Algunos de ustedes están yendo a oficinas de Continental a buscar otras opciones de viaje.